welcome to another interesting episode of the Anti-Pharmacist Podcast. How has your week been? I hope it has been nice, wonderful, and all of those good things. Well, welcome. I'm very excited today. I'm just very excited about what I want to talk about today. Okay, so I'm sure many of you are familiar with the TIME magazine in New York, right? It is a very well-known magazine that releases this list of influential people from time to time, yearly sometimes, and the exciting thing for me is that just yesterday, March 8th, which was Thursday, it released the list of 100 influential people in health all over the world, okay? And I'm very happy because some of my faves are actually there, which is what I want to let you know. So in case you haven't heard, well, you heard it first on the Anti-Pharmacist Podcast, because I believe that I'll be spending a lot of time into this episode. So without further ado, let's get right into it. There are 100 people, individuals that have been recognized to have changed the face of healthcare globally, and this list has been released for the year 2025 in a rapidly evolving global health landscape. These are the most influential voices leading the way, advancing care, shaping policy, driving innovation, and transforming lives. So we divided them into categories. We have the titans, the innovators, the pioneers, the leaders, and the catalysts. These are 100 individuals from different countries in the world, from different organizations, who are changing the face of healthcare. And you know that whatever has to do with healthcare, global health especially, it is our business on Anti-Pharmacist Podcast. So what I will be doing on today's episode, in order not to bore you, is to read out the names of these people in different categories, say a little bit about some of them, if not all. Then in subsequent episodes, I'll be picking particular individuals and just running through a profile on them, because for these people to be recognized by a world-renowned magazine, they have done something significant that is worthy of knowledge, recognition, of people knowing about, okay? And I'm very happy to say that there are Nigerians on this list, not one, not two. There are scientists that I deeply respect that are on this list, okay? There are giants of industries, there are non-governmental organizations. So it's a really good thing, when you're doing things to advance global health and you're recognized for it. It's not easy, actually, having an organization that is into science, research, global health, public health, and trying everything, especially at the wake of COVID-19 and this recent withdrawal of USA from World Health Organization, when the funding for some healthcare research and innovations have been cut, by some countries or some world leaders. So still thriving, even in these uncertain times, is worthy of applause, of accolades, which these people have received. One thing about the Times is that it's not something that is up for vote. It's not something that they say, vote for me, I've been nominated. No, they do thorough research, okay, to come up with this list. And hardly have I ever heard that people that are on this list are ignominious or are notorious for something bad. Do you understand? That people do not agree with them being on the list. So it is thoroughly researched. It's not something that they just come up with out of the blues or on a whim. Do you get? So these people actually deserve it, and I believe that they do. And well, I believe that you will also believe that they do. So I'll be starting with the titans, those that have been fighting for healthcare. The first person on the list, titans, is Tedros Adhanom Ghebreyesus. Do you know that name? Well, if you don't, that is the Director General of the WHO, World Health Organization. It was actually the one on the front page of this Time magazine list, and I believe it deserves it, with the United States pulling out of WHO. That was a big deal on the organization. I believe I did an episode on that, right? Yes, that what are the consequences. But then even after that, he's still holding the fort, That speaks to his level of leadership. What would have been expected is that everything would just crumble. There will be global health crisis in many places. According to him, when that announcement was made by President Trump, he was in Tanzania at the time, helping officials there to manage an outbreak of Marburg virus, which was akin to Ebola that killed a handful who were infected. He even aired it on the evening news. But that did not deter them. They didn't give them any heads up, Even though they had faced the threat earlier, they thought it was over. But it happened, and they still forged ahead despite this challenge. The WHO is still doing a majority of their programs, looking for ways to augment and fill the gaps that have been left. So I think this man is deserving of being a titan. So Tedros Adhanom Ghebreyesus is number one. Congratulations to him. Now, the next person is Jay Bhattacharya, who is the director of the National Institute of Health in the UK. Okay, and for the first time in history, they have the largest amount of funding for biomedical research in the world. So he's doing a great job there. And the third person is Robert F. Kennedy Jr., who is the current Secretary of the U.S. Department of Health and Human Services, under the Donald Trump administration. He has faced a lot of criticism and skepticism because of his aversion to vaccines, But it has been said recently that he's supporting the use of measles vaccine because measles mumps rubella virus has killed some Americans recently, and maybe he has seen the need for these vaccines. I just wish that people didn't have to die before government officials or people see the need for vaccination. Well, maybe we would have a change of mind later. I don't know. Then number 4 of the titans is Melinda French Gates. She's known to support health, generally health funding through the NGO Bill and Melinda Gates Foundation, one of the major contributors to the WHO Global Health, which she co-owns or co-chairs with her ex-husband Bill Gates, the famous billionaire, especially improving women's health, reproductive health, and supporting them, dedicating millions of dollars to that cause, which is worthy of note. Then there is Karen DeSalvo, who is harnessing AI for health. Karen is Google's first chief health officer, and she helped to create a lot of apps that had to do with health, like the launching of AlphaFold, the Google Health generative AI technology that helps biomedical researchers predict the shape of proteins as they develop new drugs and treatment for human diseases. Google Health has modernized how doctors and scientists, as well as patients, understand healthcare data. They have done a lot in terms of using technology to enhance health under her leadership. Another titan is David Ricks, who is doing work in speeding drug development. David Ricks is the CEO of Eli Lilly, a very prominent pharmaceutical company. Under his leadership, the company has been able to develop medications, especially for diabetes and obesity, which were approved by FDA and have been useful for people that actually needed these drugs. Another is Sumbu Desai, who is helping to merge technology and health. Another titan is Marty Macquarie, who is disrupting regulation. Alice Walton, enriching medical education. She's actually the richest woman in the world, and she's using her riches well by helping to actually enrich medical education. Her solution was to create Alice Walton School of Medicine, which we opened in her home state in Arkansas in July 2025, and we train doctors with an innovative approach that addresses the whole patient, including behaviors, lifestyle, as well as their physical symptoms. So this is what Walton has decided to do with her wealth, and we say we're here for it. Thank you so much, Alice Walton, for that. There is also the public health advocate for Africa, Mikaise Ndembe, on this list of titans. So also is Emma Wormsley on the list of titans. She has helped to bring to light the novel antibiotic that I talked about on this podcast recently for UTI, which is blue gepper, that is gepotidacin. She's the CEO of GSK, and in March they released the medication after approval by the FDA. So it is worthy of note, and that is why she's on this list. We have Paul Fitz, who is a vaccine champion, Steve Bird, who is working to diversify medicine, Narasimhan, who is accelerating change in healthcare, Michelle Zia, who is a breakout leader in healthcare, Nancy Brown, who is spreading heart health information, awareness about heart health, Christine Peck, who is helping to prevent animal disease, Michael Dowling, who is fostering innovation in healthcare. Those are the titans. Like I said, I won't have time to go into what each of these people are doing, but I'm just letting you know that the list is out and these are the people on it, so that I won't take much of your time. Let me go to the innovators. We have Reshma Kewaraman, who has helped in the development of a landmark drug. She's an innovator, okay? She said that she was destined to love science and medicine, and she's the CEO of Vertex Pharmaceuticals. She oversaw the approval of a string of breakthrough drugs. In January, FDA approved the first non-opioid pain reliever in 30 years, Junavax, which targets a pathway specific to pain neurons in tissues located throughout the body but not in the brain. Therefore, it sidesteps the addictive potential. Also, she scored another FDA approval for gene therapy using new technology, CRISPR, for sickle cell disease, and in 2024 for beta thalassemia. She is actually making headway in providing treatment for rare genetic disorders such as cystic fibrosis. That one was approved again in 2024. So, according to her, the company goes after diseases where they understand the causal human biology. They are not interested in solving diseases in mice or rabbits. So they are doing quite well for themselves. So kudos to Reshma Kewaraman. The next innovator on the list is a pair of individuals, and they are Amir Ali Talazas and Elmi Eltuki. They are coming up with a more appealing screening option for colon cancer other than colonoscopy, which a lot of Americans do not like. Number 3 innovator is Richard Lowenthal, who is looking for an easier way to treat anaphylaxis. Also, number 4, Robert Wood is a researcher about allergies and allergens, having suffered that himself. He has worked to give people with food allergies greater peace of mind. The first medication to help reduce allergic reaction to multiple foods, according to him, peace of mind. The other innovator we have here is Andrew Miller, who is looking at a novel approach to mental health. So also is Samath Kulkarni, pushing gene therapy forward. Daniel Timms is listed as the art builder. He is a bioengineer who created a device called the Bivacor Total Artificial Heart, which helped an Australian man to live a record 105 days before receiving a heart transplant. How cool is that? That is what Daniel Timms is doing. Also, David Nussbaum is looking at a more realistic virtual visit in which a patient doesn't have to go physically to see their healthcare provider. Another innovator is Ujizu, looking at autoimmune treatment breakthrough. David Lewis, another one, is a next generation gene editor, looking at how to edit genes to prevent diseases. David Fajgenbaum is another one, looking at repurposing drugs. So also is Tamit Ahmed, fighting malnutrition. Thomas Chiller and Wesley Sandquist are looking at ways to prevent HIV. Andrew Esteva is harnessing AI to improve cancer care. Bobby Reddy Jr. is looking at bringing technology to predict sepsis. Shiv Rao is working on a paperwork fix. Dr. Shiv Rao is a practicing cardiologist at the University of Pittsburgh Medical Center with an interest in machine learning, and he founded Abridge, which is a platform or an app which uses AI to turn doctors' conversation with patients into billable clinical notes that are integrated directly into health records. So this tool records patient visits, automatically transcribing it and creating useful summary. I was still speaking with a colleague of mine today about how difficult it must be for doctors to type clinical notes on electronic medical records, not knowing that somebody is already ahead of the game and creating a better and easier way for the physicians to do their jobs. Automating clinical notes, that is cool. Also, there's the pair of Apana Ede and Apana Tanega, sisters who are reaching out to women using their platform for healthcare. We also have another innovator, Beth Shapiro, who is a de-extinction scientist. Alvin Locke is looking at phasing out rare diseases. Now we have pioneers. Number one pioneer is Andreas Serchek, who is mobilizing the immune system using innovations in science. She is the section head of colorectal cancer at Memorial Sloan Kettering Cancer Center and is pioneering a new therapy that relies on using immunotherapy drugs alone to help patients with certain types of cancer avoid surgery. Number two on the pioneers list is Robert Montgomery, who is a transplant innovator. He's the director of the NYU Langone Transplant Institute, and he has been setting a number of new standards in the field. The latest milestone is the transplanted pig kidney into a woman with kidney failure, in which the organ worked for a record 4 months. And this donor pig was specifically bred to contain certain genetic changes that made its kidney less pig-like and more human, which reduced the chances it would be rejected by the patient's immune system. Also, we have Dean Ornish, who is slowing down disease naturally. Kenneth Savin is fueling science from space. He is an astronaut who is doing a lot in the International Space Station. He's the chief scientist of Redwire, a bioengineering company specializing in manufacturing protein crystals and human tissue in the microgravity environment of the station. Also, Scott Stanislavski is another pioneer who is calming Parkinson's symptoms. And I'm very happy to talk about this because this man, Professor Christian Api, actually is an alumnus of my school, University of Ibadan, and studied the same course I did at postgraduate level. He is also a very good friend and colleague of my mentor. I guess that is my claim to fame. Well, just until I get my own, right? He's a well-known researcher. He has worked a lot to understand infectious diseases, malaria being one of them, as I am a malaria researcher myself. He's the CEO of the African Center of Excellence for Genomics and Infectious Diseases, SGID, at Redeemers University, Ede, which now houses the first cutting-edge genomics research lab of its kind in Nigeria to sequence and evaluate viruses responsible for infectious diseases and work with health officials to intervene. Actually excited that Prof. Api is on this list, although I'm not surprised because, well, during my postgraduate study, that is for my master's degree, I attended a lecture of his in which he shared the various researches that he has done in sub-Saharan Africa on infectious diseases. The one that actually caught my attention was how he advocated for the nomenclature Mpox to replace monkeypox, which was a kind of stigmatizing name for the disease. I also know of his research into predictability of pandemics or diseases before they happen, so that the repeat of COVID-19, how it took us unawares, will not happen again. He's actually actively in that research right now. It is something worthy of commendation. Prof. Api has been doing a lot when it comes to infectious diseases in Nigeria and Africa and is globally recognized. Another pioneer on this list are the duo Richard Finkel and Kelly Ennis, doing work to ensure that prenatal visits are mandatory. They are made first for pregnant women. Also, another duo is Christian Angemeier and Aaron D'Souza, who are testing human limits through enhanced games. That is, those drugs that have been banned for athletes performance enhancing medications. They are looking at ways to actually legalize them so that these athletes can take them. This is why they are called those that are testing human limits. Well, according to them, they are not in the business of sports, they are in the business of science and cultural change. And the cultural change that will be the most profound will be a view that medicine is not just about making sick people less sick. Medicine is also important to elevate human performance. That is their argument. You will agree with me that that is very unconventional and a different perspective entirely. Looking at that way of science and innovation. Another pioneer on this list is Xenia Lingard, who is working to prevent preterm births. There is Dennis Chaney, who is revolutionizing depression treatment. Anthony Albanese, who is protecting young minds. Victor Ambrose and Gary Ruvkun, who are decoding cell development. There's Onkwi Deng, who is working on a self-grown cure for diabetes. Stephanie Shang is modernizing lung transplants. Shelley Wang is looking at radical idea for breast cancer reduction. Mark Hyman is personalizing care. Daniel Nadler is spreading health knowledge. Anish Bhatnagar is taming a relentless symptom. Like I said, I won't be going too deep into this because it's a lot. These are 100 people, guys, 100. So I'm just going to read them out. In subsequent weeks, I'll go into details, okay? And lastly on the list of pioneers, we have Abasi Ene Obong, our own Nigerian guy who is expanding genetics through his company Syndicate Bio. He's a scientist that I respect because he actually knows what he's doing. He's a cool guy, resilient and all of that. So we are very glad to have him on that list. Now, he's taking African genomics and genetics to the next level, making sure that Africans are included in the genetic testing information of medications. We are not just at the receiving end, but also included, which is a great thing, right? Now, leaders in healthcare. Number one is Emmanuel Subiran, who is tracking bird flu. Also, there's Placide Mbala, demystifying Mpox. There's Eunice R. Awadala, who is a heroic vaccination campaigner. Elisha Don Joju is defending global health, while Richard Seva is spreading science. Rachel Sweet is fighting for reproductive rights. Alison Cecil is relieving medical debt. Peter Anevsky is protecting IVF. And another Nigerian, Ladidi Kuluwa Bako Ayegbusi, is fortifying a staple food. She is the director, head of the nutrition department of the Nigerian Ministry of Health and Social Welfare. She's working with NAFDAC as well as companies in private sector she oversees on an innovative program that takes the common staple of Nigerian kitchens, bouillon cubes, what we know as Maggi, and fortifies them with micronutrients to nourish children, even if they can't always get enough to eat. So these cubes are boosted with everything from iron, vitamin B12, and folic acid to zinc. Even if the families cannot afford protein, fresh vegetables, they can afford the much less expensive bouillon, and Bako Ayegbusi hopes to see rates of malnutrition, stunting, and developmental disorders related to malnutrition start to decline in Nigeria. That's our contribution to global health, and we say kudos to her. That's one person using an office for good of the public. Another leader on the TIME100 Health list is Francesco Rubino, who is redefining obesity. We have Evan Masingil, who is helping to gain more access in terms of reproduction. Paul Muller is stopping suicide through his innovation. Julie Bocart is preserving care. Adrian Dibwart is tracking community air quality. Peter Lorry is fighting for safer food. Ronita Nath is validating LGBTQ plus youth. Muhammad Ali Pate, our Honourable Minister of Health and Social Services in Nigeria, is shaping Nigeria's health systems. By helping to promote global health in Nigeria, he has come up with various initiatives since October 2023, which has helped to vaccinate over 12 million girls against the human papilloma virus, and he has upgraded more than 900 primary healthcare centers this past year, which have served 12 billion people. It keeps bringing innovations that will help the general public to the healthcare space. So also is the recent CMOC that I talked about some time ago on this podcast, to reduce complications and deaths that come after childbirth. So I think the Honorable Minister of Health is doing a good job, and he has been recognized by the TIME magazine. So congratulations to him. Also on the list of leaders is Joanna Strober, who is spotlighting menopause care. Now to catalysts. This is the last category of people on this list. I'll just run through them, alright, because I've taken a long time reading these names. It's not easy to read 100 names now and talk a little about one or two of them. Dema Amlin is the first catalyst on this list. Is a powerful voice for cardiac care. Vinod Balachandran is testing a cancer vaccine. How cool is that? I'll talk about Vinod on a subsequent episode. I'm very sure of it. Catriona Bradshaw is reframing a woman's issue. Whatever that is, she must be doing a good job for being on this list. Brooke Eby is documenting ALS. ALS being amyotrophic lateral sclerosis, otherwise known as Lou Gehrig disease. She's documenting it, making people aware of it, talking to people that have it, like that. We have Barbara Kingslover, who is turning fiction into addiction treatment. Bill Nye is a scientific evangelist. Aradazi is another catalyst who is sparking reform. Colin Farrell, who is an actor, one of the very good actors that I know, is a voice for special needs. Lorenzo Guglielmetti is treating tuberculosis. Kate Middleton, the Princess of Wales, is leading with her story. You know, she was diagnosed with cancer and she didn't hide it. She came out to talk about it, and she's giving people hope and lending a voice for the awareness of cancer in that way as a public figure. Then we have Suresh Ramalingam, who is looking at a breakthrough against lung cancer. We have the duo of Seth Rogen, another actor, and Lauren Miller Rogen, his wife, who are supporting caretakers. We have Stephen Graham and Jack Thorne, who are sparking a conversation in health. We have Scott Lomerade, helping teens thrive. We have Leona Meha, who is showing strength. She won bronze medal for rugby at the 2024 Olympic Games, and she weighs about 200 pounds. She's showing strength when it comes to weight. She doesn't think of the word big as derogatory. There's Mary McCormack, who is bringing a change of pace to the healthcare system. Ayman Scott, who is preventing STIs. I'll definitely talk about him on this podcast, so watch out for that. Then we have Dwayne Wade, the basketballer, the husband of Gabriel Union, who is pushing preventative care. These are the TIME 100 Health personalities of 2025.
Hope you were paying attention and counting with me. We had 18 titans, 22 innovators, 22 pioneers, 18 leaders, and 20 catalysts. I dare say that anti-pharmacist, Bimisola Adipsi Jose, is the 101st person. Well, that's on a lighter note. But who's to say it's not possible? That is to say that if you're somebody passionate about global health, please keep doing the little you can where you can to advance public and global health through research, innovation, thinking outside the box, collaboration, raising awareness, making your voice and that of others heard. There are different ways to effect change. Maybe one day you'll also be recognized like these people. I'm sure that these people did what they were doing not for the accolades or recognition, but because of their individual passions for these various aspects of public and global health. So contribute your own quota too, and maybe one day you get the recognition and accolade you deserve.
So guys, like I said, watch out for the profile of these people and the work they do in details on subsequent episodes of this podcast. I'm very excited about this list. These are individuals I want to dissect, for lack of a better word. Look at what they are doing, bring it to your notice, see how they are helping the world and bringing it to people's ears. I'm sure that many of these names, majority of us haven't heard of them before. Honestly, as an individual, this is the first time I would actually see that name, Alice Watson, being the richest woman in the world. I would definitely research her because me, I'm a researcher normally. Yes, because we know and hear of the richest man in Africa, richest man in the world, or richest woman in the world, and using her wealth to create a medical school that is brilliant and commendable, right? So, guys, I'll be talking about her on another episode of this podcast. Watch for that. And that is all I have to say on today's episode. I believe that I've said enough already. Thank you so much for joining me today. I hope that you enjoyed it as much as I did. So tell me in the comments, which of these people do you know or have you heard about, whose work you're familiar with, tell me. Or which of them in particular do you want me to do an expose or an in-depth look and analysis into their work in global health? Let me know in the comments, okay? I'll be seeing you next time. Do not forget to share, to like, to comment, to subscribe to this podcast. Do all these good things, okay? On all the social media platforms, on all the podcast hosting channels, on YouTube. Share with your friends, colleagues, comment, do all of those good things for your girl. I appreciate it and I'll continue to appreciate it. And of course, send me your mails at antipharmacistpodcast@gmail.com. Send your question in the DMs and all of that. I'll try my best to reply you. I know I will, okay? You can also comment under my post on LinkedIn. ABC just said I always post on my LinkedIn. So check it out, guys. Follow me as well, okay? Talk to me in the DMs. I'll be sure to reply you. Yes. So till next time, stay healthy and God bless you. Ciao.